My name is Jules Bizimana. I'm a lecturer at Ihuye, and my department, where I'm from, uh, I am one of the faculty of medicine and pharmacy at Ihuye campus. My specialization is a clinical microbiology and immunology. Yeah, so I thank you and I thank Christine, which who helped me to set to this online teaching. Yeah, I don't want to spend much about this presentation or myself presentation. We can now straight forward on the next slide. Yes, today, the course of today is clinical virology. We have many viruses, but why it's called clinical virology? So we just focused of some viruses that may cause a clinical disease. Yes. So a virus, as one of a part of a microorganism, a virus is a submicroscopic infectious agent that replicates only inside the living cell of an organism. So if you remember in microbiology courses, we have a bacteria, we have a parasite, we have a fungal. So virus also is part of among those microorganisms. So they can now cause a disease for our human being, for the human being. A virus are the smallest infectious organism. They have either RNA or DNA. This is the major characteristics of a viral microorganism. Normally, when you see this structure of viruses, it's called virion when it is in the external of the cells. A virion is a complete infectious viral particle. Viral core is the viral nucleic acid genome located in the center of the virion, which control the viral heredity and the variations. Is responsible for infectivity. So this normally a virus have the three main structure. It is started by external particle envelope and the capsid, also a viral core that contain a nucleic acid of this virus. Now, remember that bacteria have their own characteristics, parasites have their own characteristics. The virus now have the general characteristics. Yes. A virus are normally fat agents. Virus are obligate intracellular parasites. So means virus cannot survive out of the cell. It must always intracellular. A viral genome is neither RNA or DNA, but not both. That makes a special difference with a bacteria or other parasites. Viruses may or may not have a lipoprotein envelope. Yes, this is not the virus is not mandatory to have an envelope. Viruses are metabolically inert and they can only replicate inside the host cell. Virus cannot survive longer out of the cells. Viruses are very small with the size ranging between 20 to 200 nanometer beyond the resolving power of the light microscopy. Yeah. Let me come up with the structure of a viruses. Normally, viruses must have, as I told you in the previous slide, must have a viral. Must have let me say, sorry, we have a coat, a protective coat on the surface. We have inner part called a capsid. The capsid, it always cover the nucleic acid or the genome. Yes. So normally, some virus may have an extra protein called a glycoprotein and a glycoprotein 1, even a 3. Those are the general structure of viruses. And then we may have around 4 types of viruses. Some may have a helical, hedro, some have a symmetric, depending on the types of the virus structure. Yes, we have also some complex viruses. So we can now next for the next slide.
There is a question on the characteristic of virus.
Oh, which question?
Yeah, there is a question on the characteristic of virus.
Characteristic of virus.
Yeah.
Okay. Which questions, please?
Answer the question.
Okay. Good morning, first of all.
Yes.
I have seen that virus cannot have both RNA and DNA, but I have heard of HIV that the reason why it is not possible to be treated is because its genetic material can change either from RNA to DNA, then next time DNA to RNA. How can it be explained in that concept?
Yeah, thank you. I've understood your questions. HIV viruses, it is a RNA viruses. It carry RNA genome, but during infectivity, it has the enzymes called reverse transcriptase. So the time of entering in the nucleic acid in the nucleus of a human host, that enzymes turn RNA into DNA due to these enzymes called reverse transcriptase. But the original genome, it is a RNA. So after infecting the cells, during their pathogenicity, some viruses carry some enzymes. Always turn the RNA into DNA so that they can now fit in a host genome. The question now has answered. HIV is retroviruses group. Yeah. Because all of those retrovirus group have this kind of reverse transcriptase enzymes that always turn the RNA nucleic acid into a DNA nucleic acid. Yeah, that is it.
Okay, thank you. I think you know.
Okay. Now, the component and the structure of viruses. The virus always contain a capsid and the envelope. Isometric or icohedral viruses have shapes that are round, spherical, such as the polioviruses or herpes viruses. Envelope viruses have a membrane surrounding a capsid. Yeah. Some of a virus can be either DNA or RNA. A virus cannot have both. A DNA double-stranded may have a linear or a circular shape. A single-stranded, it's linear or a circular. A RNA, it's segmented or nano-segmented. That is a characteristics of the genome of viruses. Yeah, now all viruses, yes, the viral capsid and yes. So now the protein shell or coat that encloses the nucleic acid genome. The capsid is a virus's coat. It is made up of a protein arranged in multiple identical units called the capsomeres. Those are the protein that made of this capsid. Now, a function of this capsid, it always protects the viral nucleic acid. It participates in viral infections. It shares the antigenicity. You understand the antigenicity means when the virus entering the body, this kind of a capsid may stimulate the immune responses, or in other words, body immune system can recognize a capsid as an external antigen. Nucleocapsid is defined as the core of the virus's particle consisting of the genome plus a complex of a protein. So it means the nucleocapsid, it's a mix of nucleic acid plus capsid. A complex of a protein, structural protein, plus nanostructural protein means the enzymes plus a nucleic acid binding protein. That's how viral capsid. The envelope as external parts of the viruses, we have two kind of structure based on the envelope. It's not mandatory that all of viruses may have an envelope. Those who don't have envelope, they call a naked viruses. So do not have envelope anymore. Some group of viruses have an envelope. You can see those protein that protect inactive viruses. We have a capsomere, and that are called naked viruses do not have a protective cover. Let me say like that. We have another group called envelope viruses. Those they have a complex structure of the viruses, started by genome, capsid, also an envelope. Yeah, that is how we can say about enveloped and naked viruses. Envelope consists of a membrane that contains a lipid derived from the host and the protein encoded by the viruses. So normally the envelope is acquired as the virus exit from the cell in the process called budding. Viruses encoded glycoprotein are exposed on the surface of the envelope. Normally, when you see all of some viruses may possess some external glycoprotein on the envelope. Yeah, for example, on HIV, we can give an example. We have a glycoprotein 121, glycoprotein 41. Those are the different glycoprotein that can be found on the envelope of viruses. So the function of this envelope, it carries what we call antigenicity, infectivity, and resistance. So means resistance means it against the action of immune system. Not all of viruses have an envelope. Therefore, the viruses can be divided into two kinds: enveloped viruses and the necked viruses. That's how we can now group the based on the envelope. Here now you can now compare the viruses and the bacteria. You can see a typical bacteria, Rickettsia viruses. These bacteria, some are intracellular, yes, and then intracellular parasite, bacteria, no. Rickettsia is intracellular. Viruses is always intracellular. Plasma membrane. Bacteria have yes. Then Rickettsia have also, because it is a bacteria also, Rickettsia and the chlamydia. They are bacteria, and always intracellular bacteria. And virus do not have a cell membrane. Binary fusion, bacteria and the chlamydia have, but viruses do not divide it by a binary fusion. Pass it through the bacteriological filter, bacteria no. Some Rickettsia and the chlamydia, some no, yes, but always viruses, yeah, yes. Possess both the DNA and the RNA. Of sure, viruses do not. Must have one RNA or DNA. ATP generating metabolism, of course, because the virus it's not a complete cell. No. Ribosomes, the viruses do not have. Sensitive to antibiotics. You cannot treat viruses using antibiotics. Never. Sensitive to interferon. Yes. Because an interferon, it's a protein produced by immune cells to fight against microorganisms. So interferon, it is a cytokine which can have a positive side effect, or can kill the viruses. Next, classification of viruses now. These seeks to describe a diversity of viruses by naming and grouping them on the basis of similarities. There are three different ways of classifying of viruses. They are pathogenicity. Normally, all of viruses may have different pathogenicity. Yeah, they cannot, because each viruses have their own way to damage or to develop a disease in human host. We can now classify them based on ecological characteristics. You can also classify them based on physical chemical characteristics. That is a way you can now grouping the viruses. Yeah. So now let's start about pathogenicity by now explaining the replication of viruses. Because there are 7 steps required in the viral replication. Even if it is a small, but once they enter the cells, they have the only way to replicate, make many copies. We have first step of attachment, entry, encoding, transcription, translation, assembly, virus release. Those are the 7 replication steps. Attachment. So virus must attack the host cell before replication. It must be able to attach to a specific receptor on the plasma membrane of the host cell. The susceptibility of the host to virus infections depend on the appropriate cellular receptor. That's why HIV, it's always targeted the CD4 receptor of T helper cell. You remember T helper cells is a lymphocyte. Yes, because an entry, the virus can enter into the host cell by one of the following mechanisms: receptor-mediated endocytosis, the attached viruses is internalized and localized in the endosomes and released into cytoplasm. Injection of a nucleic acid into the cell and the retention of the outside. It can occur through fusion of the viral or the viral envelope with the host cell membrane and the release into the cytoplasm of the host cell. So after attachment to a specific receptor, they must fuse, internalize into a host cytoplasm. That's what we call entry. They must enter the cell. Number 3, uncoating. Uncoating means some envelopes may remain out of the cells. Encoding the release of the nucleic acid from the viral coat. You remember coat means is those envelope must remaining out of the cells. Then the capsid internalize into the host cell. It occurs on the cell membrane, cytoplasm, or nucleus. It is facilitated by cellular enzymes in the viruses, because viruses has several enzymes. Yes. Transcription. It is the synthesis of the viral nucleic acid. It involves the use of viral genome to make a copy of a new RNA, which may be messenger ribonucleic acid. Messenger ribonucleic acid. You know, when it transcripting means copy the information to the original genome. Okay. It is catalyzed by an enzyme called polymerase. This may be means of a host cells or a viral specified. So transcription, I think you understand, is the way of copying the message from the DNA. Just for transcription. Okay. Translation now. Remember in high school, translation means making a protein. And this it happens in the ribosome. So after now transcription in the DNA, so the virus must make their own protein in the cytoplasm. It involves attachment of the messenger RNA to ribosomes in the cytoplasm of the host cell. So it uses some host protein to make their own protein. Assemble. So once now the virus already made their protein, the newly synthesized nucleic acid and the protein are assembled in the nucleus of the host cell to make their own complete viruses in the cell, especially in the cytoplasm. So once now the complete viruses are made in the cytoplasm, the next step is to release out of the cell. This is the disintegration of infected cells to release the virus particles. These occur in non-enveloped viruses. In the most enveloped viruses, there is what we call bedding from the cytoplasmic membrane of the host cells. The envelope are acquired during this process. That's how you can see in the cytoplasm of HIV, a CD4 cell, you may even have 1,000 copies of the viruses in one host cell. Yeah, that's the series of the virus. It makes many copies in the cytoplasm of the host cells, then released out of the cells. So that is the main basic about general characteristics of a viruses. As you guys nurses, you need also to know some viral diseases that affect many people. Any questions? Okay.
So I was asking that some
Yes.
viruses during its replication, they are able to destroy the host cells. So is there any relationship between having RNA viruses and DNA viruses to the destruction of cells?
Yes, I get you. So both, they share one of even RNA, even DNA viruses, both have those steps, viral replication. Can we go back to the previous slide? Yes, it's okay. This, all of them, RNA and the DNA, all of them must have this 7 step of replication. All of them must destroy the host cell. Yes. In order to be released from the host cytoplasm, also to be released out of the cells. So your question means both the DNA and the RNA, those share these characteristics of destroying the host cells. That is it. Yeah, thank you. So some viral disease, we can now have some viral infection for cerebrospinal system. We can now list some of them. Once you are infected with the types of viruses, they target your nervous system and made up of spinal cord and the brain. So this virus, they can now damage these nervous system cells, they're called a neuron cells. So the virus that were reported to infect central nervous system include polioviruses, rabies viruses, herpes simplex viruses, herpes simplex virus type 2, even varicella zoster viruses. Those are the main viruses. Once you are infected with their target cells, they are neuron. We have poliomyelitis. Poliomyelitis, it is a disease caused by polio viruses. This is a highly infectious viral disease caused by polio viruses. It largely targets and affects children under 5 years old. Sometimes it causes some paralysis. The virus is transmitted by person to person, spread mainly through the fecal-oral route, or less frequently by a common vehicle. Vehicle means contaminated water or food. And they multiply in the intestine as an initial infection, from where it can invade the nervous system and cause paralysis. That is a polio. So pathogenesis, normally it must enter into a mouth. Primary multiplication will take place in the oropharynx or intestine. The central nervous system may then be invaded by way of the circulating blood. Polioviruses can spread along axons or peripheral nerves to the central nervous system, resulting in destruction of a neuron, which may lead to paralysis of parts of the body controlled by these destroyed nerve cells. You can see how poliovirus does not multiply in muscles in vivo. The changes that occur in the peripheral nerves and the voluntary muscles are secondary to the destruction of the nerve cells. That's how it causes a disease in our human body. Clinical features. So these polioviruses have an incubation period of 7 up to 14 days. Do you remember COVID-19 in 2022? The incubation period of coronavirus is also 7 to 14 days, so that you can have a first sign and a symptom. Most infections are asymptomatic, 95%, means only 5 get disease. Abortive polio, it can now characterized by fever, malaise, sore throat, myalgias, and headache. Aseptic meningitis, paralytic polio, 1% can cause this one. Paralytic polio, major illness. It's characterized by fever, headache, irritability, and the different paralytic manifestation according to the part of the central nervous system involved. 4, where it affects now. spinal polio, the lower limb, are the most commonly affected. Bulbar polio paralyzes of the muscles of respiration. Bulbar spinal polio. Post-polio syndrome, it's a progressive atrophy years later. That's clinical features. Yeah. You can see how those children under 5 years are affected. Yeah, because remember those under 5 years, they are considered the people who don't have a strong immune system. That's why some of them cannot able to fight the polio viruses. So epidemiology, that disease distribution. Normally, a wild poliovirus cases have a decrease by over 90%. So means it's rare. It's rare to find these polioviruses in many countries. So since 1988, from an estimated 350,000 cases in more than 125 endemic countries to 6 reported cases in 2021. Of the 3 strains of the wild polioviruses, type 1, type 2, type 3, wild poliovirus type 2 was eradicated in 1999, and the wild poliovirus type 3 was eradicated in 2020. So, as in 2022, endemic wild poliovirus type 1 remained in 2 countries, Pakistan and Afghanistan. You can see, even if it's a serious disease, but many of them has been eradicated. How can you diagnose this poliovirus? These polioviruses? So you have to do virus isolation, taking a swab, a sample in the throat swab. You can also use a feces in the rectal swab. It's grown and identified in a cell culture. You cannot cultivate these viruses as a normal culture, the way you do in the bacterium. It has the only way of culturing using the cell culture. Yeah. They require molecular technique to differentiate between the wild types and the vaccine types. Actually, the accurate test nowadays is molecular technique. Molecular technique. Yes. Number 2, we used to do serology, antibody antigen interactions. You see the antibody antigen, the sample we expose together, then you see what the reaction, immunochromatography or some agglutination. But most of the time, it's use a ELISA test. Yeah. Now, treatment modalities. Normally, no cure for polio. Treatment is directed at controlling symptoms and the complication. Physical therapy, bed rest, pain relievers, portable ventilators to assist breathing. That is how you can now manage the polioviruses. Because normally, prevention and the control of poliomyelitis, the only way of treating the virus is vaccine. Yeah. So the poliomyelitis, yeah, sure. You have a Salk and a Sabin. This is a type of vaccine for poliomyelitis. So some it's made up for killed viruses, some are alive attenuated. By using around 3 serotypes of poliomyelitis, of polioviruses. Viral gastroenteritis, so stomach and the flu, stomach flu. So general features of this gastroenteritis. The second most common infections after the respiratory tract, mainly disease of infant and the young children. The major cause of morbidity in infant, the young children in Asia and Africa country. Mostly self-limiting disease recovery usually is usual. Diarrhea, vomiting, abdominal pain are the major symptoms. When you talk about gastroenteritis, it's all about GIT. So the virus is causing diarrhea replicates in epithelial cells over the small intestine and shed freely in the stool. So if viral etiology of these GIT viruses, we can now mention some viruses. Rotaviruses, previous slide, come back. Enteric adenoviruses, astroviruses, noroviruses, and sapoviruses. So these GIT viruses, they can be transmitted through person to person through contaminated hands, eating fruits and uncooked vegetables contaminated with infectious fecal material, drinking water contaminated with infectious fecal material, contamination of uncooked food, fruit, and a salad by food handlers. Mainly infants and young children, norovirus affect all age groups. After occurs in the closed or semi-closed communities such as hospitals, dormitories, the prisons. Virus that are transmitted by the fecal route are endemic in area with low standard of hygiene in the sanitation, primitive sewage system, no adequate water pipeline system, crowded living condition, and a low educational level. Those people, they are endemic of these GIT viruses. So normally incubation period is 3 days. The main symptoms are watery diarrhea, vomiting, abdominal cramping and pain, fever, duration only 2 to 7 days. Prognosis, the absence of dehydration, the disease is mild and the recovery is usual. Complication is dehydration. So you see, normally main gastrointestinal tract infection is not only parasite, bacteria, or some viruses may cause some abdominal infections. Yes, you have to consider this. You can see a person that have these disease caused by viruses can also associated with diarrhea and vomiting. Yeah, you can see even more many children. By replacing of fluid and electrolyte lost by diarrhea, children with diarrhea who are unable to take a fluid by mouth because of nausea and vomiting may need intravenous fluid That's how you can manage the diarrhea caused by viruses. It's just a replacement of these electrolytes and the fluid. So you need to wash hands with soap and the clean water before preparing food and eating. Washing hands with soap and the clean water after using the toilet, changing the yes, yeah, papers. So disinfection of contaminated surfaces such as toilets, carpet, floors, yeah, so on. By detection of these viruses in the stool, use ELISA, enzyme immunoassay. These viruses shed freely in the stool. Yeah, for sure. A contaminated stool hygiene can now be one way of spreading this viral disease. Now, rotaviruses. A rotavirus is caused by double-stranded RNA viruses in the family of Viridae. It is characterized by vomiting, watery diarrhea, and it is most frequent in children. This is one of gastroenteritis disease caused by virus. The primary mode of transmission of fecal oral route, usually through direct contact between people. Transmission also occurs through ingestion of contaminated water, food, and the contact with the contaminated surface or object. Large amount of viral particles are shared in the diarrhea, stool, and vomitus of the infected individuals. So these rotaviruses, they have our own structure. It's well-shaped. Genome consists 11 double-stranded RNA segments. Each virus particle has a triple layer coat composed of the different structure protein, about 8 nanometer in diameter. This you can see even some protein find on envelope. Yeah, you know, envelope has around 3-layer coat. Yeah. Rotavirus infection is characterized by nausea, vomiting, and watering, no blood diarrhea, loss of appetite, and dehydration. Normally, the diarrhea caused by viruses do not contain blood, like amoebas and so on. The gastroenteritis is more serious in young children. Adults usually have a minor symptom. Why? You can understand the difference. Rotaviruses are leading cause of severe dehydrating diarrhea in children aged less than 5 years old. Globally, with an estimated more than 25 million outpatient visits and more than 2 million hospitalizations attributable or to rotaviruses infection each year. In developing countries, 3/4 of children acquire the first episode of rotavirus diarrhea before the age of 12 months, whereas in developing country, the first episode frequent delay until the age of 2 to 5 years. See, Black people, the African people, they are strong. Severe rotaviruses, gastroenteritis is largely limited to children aged 6 to 24 months. Normally, a diagnostics of all types of viruses. It comes with in two ways. You can use ELISA or radioimmunoassay. The last one, you can use what we call molecular technique called PCR. They are used in research laboratory. So the purpose of this ELISA radioimmunoassay is detecting specific antibodies against a virus. But for PCR, polymerase chain reaction, mainly it targets the presence of genetic materials in the sample in the laboratory. Treatment of gastroenteritis is supportive to correct the loss of water and electrolyte that may lead to dehydration, acidosis, shock, and death. That's your role, nursing. Yeah, putting some drip in the patients to dehydrate the patients. Management consists of replacement of fluid and the restoration of electrolyte balance, either intravenous or orally as feasible. There are no antiviral available. Make sure that there is no specific drug to virus. There is no antibiotics. You can prevent these rotaviruses by proper fecal disposal, effective hand washing, contaminant and disinfection of soiled area and bedding, carefully processing of food and dedication of food handle, purification of drinking water, the swimming pool water, vaccination by rotavirus. This is the vaccine for rotaviruses. Viral respiratory tract infection. It's good, you guys, to know at least some list of viruses that may affect different part of your body. Here we're going to talk about the viruses that affect respiratory tract cavities. The most commonly is influenza viruses. Influenza is a serious viruses, always even cause some flu. We have rhinoviruses, coronaviruses, parainfluenza viruses, adenoviruses, respiratory syncytial viruses, other like rubella, enteroviruses also have been associated with the respiratory tract infection. So you can see now. We have some viral or sexual transmissible infections. Viral of sexual transmissible. You have to know this difference. We used to say STI as a sexually transmitted infection. This infection is transmitted through sexual contact and they may cause disease everywhere in the body. For example, HIV, HBV, HBV means hepatitis B viruses. HPV. So those are the viruses. Once you are affected, they can now cause a disease everywhere in the body. STD refer to a sexually transmitted disease. These diseases are transmitted through sexual contact and they cause a disease within the genital urinary tract. HPV and HCV, those are the viruses mostly affect our genital tract cavity and the genitourinary tract cavities.